Hello there. You are watching Mindcraft, and this is the OET series. In this episode, let us look at a few more OET nurse speaking card examples. In the following cue card, the setting is an emergency department. Let us read the card. Your patient is a 20-year-old librarian, and has just had sutures in the department after receiving a serious dog bite on his or her right hand. You see him or her explain how to look after the wound. The tasks are to confirm patient's wound treatment is complete. Explain your role, wound care instructions, etc. Find out how patient is feeling. Find out what patient knows about wound care. Give information about wound care, example, keep wound clean or dry, dry gently, apply new dressing if wound gets wet, etc. Find out about patient's job and if right or left-handed. Stress need for extra care with hand in first few days, example, aids healing, avoids opening or infecting wound, etc. Advise on possible sling use, example, reduction in swelling, better protection or awareness of affected area, etc. Reassure patient about infection, example, wound clean, course of antibiotics started, tetanus up to date, etc. Advise on signs of infection, example swelling, increased pain, feeling of heat, leakage of pus, etc. Give details for removal of sutures, see nurse in 7 days, etc. Establish patient's willingness to return home. Let us move on to the conversation.
Good evening, I'm Lisa, an emergency care nurse. As you were bitten by a dog, we treated you in emergency care. Do you feel better? Can you reconfirm your name?
I am Jade, working as a librarian. Last night, after my duty hours, I was walking back home. Suddenly, a dog sniffed my snacks cover, randomly attacked me by biting deeply on the right hand. Further, I called the emergency.
I am sorry to know about this, Jade. Of course, the wound is deep. Do you want to know about the wound care?
Yes, nurse. Please tell me.
Let me brief it out. What is wound care? Firstly, to stop the bleeding and to remove the dog's saliva, I cleaned it with direct running water and damped it with a dry cloth. Then, I applied antibacterial ointment and covered it with a bandage. As the wound is deep, with jagged edges, it's significantly scarring. Hence we sutured. Obviously, it takes 2 weeks to heal. You must avoid opening the wound because it leads to infection. Keep it moist-free, otherwise pus will get collected, which is quite dangerous. If you swing the hand, you get swelling. Eat a balanced, nutritious diet for the better healing.
Nurse, I am afraid that I would get rabies. What should I do to prevent it?
I understand your concern. If you had been bitten by the rabies dog, yes, there is a chance. I would like to know, have you been immunized with tetanus? Otherwise, we will give you a tetanus booster and rabies injection. Because the dog bite is deep and it has wounded the tendon and bone. Do you understand?
Oh, nurse, I am really confused. How about the stitches removal?
Yes, Jade, don't be dazed. You will be all right soon. We used non-dissolvable stitches to avoid itching, redness, and its strong infection. You must visit after 7 days for the stitches removal.
Okay, nurse. I understand. Thank you.
Please take care of yourself. Thank you.
Great! We tried to cover 5 different examples for the OET nurse speaking section. Hope this gave you an idea of how to collate the points from the cue card and use it in the conversation. Keep practicing. And thanks for watching.